Well, good morning and welcome to City Talk. It's a weekly radio program. It's a podcast. It's a TV program. It's a way that here at the City of Waco we communicate with citizens, you as listeners and viewers, about the great things happening in Waco. And one of the things that are happening in Waco we all know about is about the COVID. And today our guest is Kelly Crane, who is the communication lead for the Waco McLennan County Public Health District. If I go too fast, I really can't get it.
I just run right through it. Yeah.
You're on TV and doing responses unbelievable all the time and doing a fantastic job. And I wanted to have you on because we're in the pandemic to the stage of the vaccine, and we want to talk still about testing. But we're also going to talk a little bit during this program about the flu this year, because sometimes we've forgotten to mention the fact that we're in flu season right now, and that's a challenge for the medical community to do two different types of things, and so we'll get into that just a little bit later on. Let's bring us up to date now on COVID right now. The vaccine is the huge thing. Moderna, we're now hearing about some of the agencies getting Pfizer. Tell us about and you're always going to speak because of the public health district's perspective. Go ahead and tell us about where the health district is. I know we're starting to get more and more. And talk.
Absolutely. Well, as a health district, we're receiving the Moderna vaccine, and we're receiving it directly from the state of Texas, the Department of State Health Services. In fact, everyone right now in the state of Texas is receiving their vaccine from the Department of State Health Services. There are a few exceptions. The nursing home program is a federal program, and the pharmacy programs that should be starting up relatively soon are coming straight from the federal. But when you think about all of our other providers, traditional providers, we're getting directly from the state. We have received Moderna, the Moderna vaccine from the state, and that's what we are offering. Other providers may receive Pfizer. Now, Pfizer is interesting. They're both quality vaccines. They're both the same type, the mRNA vaccine. But Pfizer is a little more delicate. It requires ultra cold storage. So it really depends if you have that capability if you're going to get the Pfizer vaccine in your provider's office. So be aware that there's nothing really different about them. They're both quality vaccines, have that high anywhere between 90 to 95% efficacy. But you need to remember, sometimes it's just really about the storage. So don't be concerned, if I have Moderna or should I get Pfizer? Both are quality, both work. Take what you can get. Take the one you can get. Yeah.
It's not enough, right? They just want to get it.
Exactly.
They want to get the vaccine. And now, describe to us the difference in what we call a hub. The McLennan County Public Health District is designated as one of the two hubs here in McLennan County right now. Talk about that and what that means, because there are alternatives besides the health district to get your vaccine. So don't only listen to what Kelly has to say about what we can provide you through the city, but there's other things. Talk about the hubs.
Well, the hubs were a designation from the state, and what they realized very quickly in December was that providing 200 doses here, 100 doses there was just not meeting the need. There was such a demand. So we're fortunate we were designated as a hub. That means we receive 1,500 doses per week, and we have for the past 5 weeks. And our goal is to get it out quickly to anyone who wants it that is in with 1A and 1B. And so that's why we can accept people that are not patients. We can accept people that live outside of McLennan County. The only thing you need to have, of course, is an arm, and you need to be in 1A or 1B, and we'll be able to vaccinate you. And those vaccination hubs are throughout the state. They started out with 28. Now they have 82. So we are charged with vaccinating people as quickly as possible, and we're receiving large doses to do that, and that's really exciting for us. We're really pleased with that opportunity. Now, there are other providers in McLennan County, and you can look on the state's website to find them. They may only be getting 100 or 200 doses, and so it may be a little bit more difficult to go to them directly, and that's where we meet the need, is that we can vaccinate a lot of people extremely quickly.
And again, some of those places are only getting 100 or 200 or whatever, because when you look at the numbers that are being distributed statewide, there's a lot of towns and small cities and things that are needing just like everybody else. But again, let's go back to your 1A and 1B. We're still locked in on that, and it looks like we're going to be that way for several months at least, until those people in those categories are the ones who receive the vaccine.
Exactly.
Those are the ones have been labeled that way because those are the most vulnerable and the most necessary to receive early on to prevent death, and that's what we're looking at.
That's our biggest concern, is that group, particularly 65 and up. has a high risk of not just getting sick and hospitalization, but also death. And so we really want to focus on those age groups. And that's what this hub does. That's what we're designed to do. That's why 1B is there. We're also looking at people with those underlying conditions. So you say, well, wait, I'm 63, but I have COPD, or I've had heart surgery, or, I have severe diabetes. Fortunately, that group is in the category too. So it's 1B is a pretty broad net. I mean, there's age is a risk factor, but if you have any other physical conditions, you count as well. That's going to take time. With 1,500 doses a week, it is going to take time to vaccinate everyone. So I wouldn't predict. I learned, don't predict how long it will take or how long it will be in this category, but just know these are our most at risk, and we've got to get them vaccinated.
Well, don't predict is what my next question is going to kind of be.
Okay.
You keep saying 1,500 a week, 1,500 a week. What do you think, or maybe have you read or seen any or heard any trickling of information that will continue, that will start rising in any time soon for the allocations of the health district?
Well, we're receiving our 1,500 a week standard, and when this airs, we'll have also started doing our second dose. And so the state is not only giving us an allocation for our first dosers, but we're getting an allocation for our second dosers. So when this show airs, we will have done 3,000 vaccines in 3 days. So yeah, we're getting more to accommodate our second dosers now. We'd love to get even more. It's just really going to depend on that supply. I will say I have to compliment the state on what they're doing as far as delivery. They do not let vaccines sit on their shelves either. When they get it, they ship it out to us directly so that we're able to offer the vaccines. It's just a matter of supply and demand, unfortunately. I had someone ask, why can't you do a 24-hour, 7-day-a-week vaccination clinic? It's like, because we don't have enough vaccine.
Yeah.
I mean, and not even consider people resources. We don't have enough vaccine.
But I think the answer to that question is the fact that you all probably could, because that's what I want to make sure everybody understands. You all have done an amazing job of spinning up the vaccination clinics, not only the convention center that the health district has been behind and the emergency management office, but also the partnership, and we'll talk about in a minute, with Baylor University, the drive-through. So the capability, the potential to be able to do the vaccinations is really, y'all are doing it amazing quality. We've had compliments like everywhere and telling us how well run, how nice and friendly the whole thing works. So it's not that, but like I say, it's the supply and demand.
Exactly. And we started out doing 98 appointments per hour, and we have moved to 138 appointments per hour, and that will get us about 1,000 per day. And we could still push the edge a little bit more on that. So we're ramping up to do 1,000 doses per day. That's 1,000 people going through our vaccination clinics per day. We're ready for extra doses. We're ready to extend the clinics. It's just a matter of supply at this point.
Yeah. And that's a huge deal. And of course, there's talk about having, with Johnson & Johnson potentially coming out and getting approved, a different vaccine. But again, it's another vaccine, and the competition maybe, and maybe the driving force would be allowing 3 vendors, as it may be, to provide numbers. Talk a little bit about that. And you mentioned earlier about the Pfizer and the Moderna not being really much different between the two. But Johnson & Johnson is talking about being a one-shot deal, and maybe not quite as effective. But then let's kind of parallel that to maybe what we've experienced with the flu shot.
I think that you brought up a lot of good questions. So Johnson & Johnson has many positive factors. The first is it does not have to have cold storage. It can be in regular refrigerator temperature. So that makes things a lot easier for many providers, and including the health district. It is a 1-dose series. That takes a lot of stress off people worrying about getting that second dose. I know that's caused a lot of stress. People want to get completely vaccinated. So that is a benefit. When we talk about efficacy, when you look at the efficacy numbers, there's a lot of different numbers, but overall what they saw in the United States was around 60%. It was higher in other countries where they also tested it. They tested it through South America, and there were higher percentage rates. But let me tell you, 60% is a great efficacy rate. It really is. I would not snub my nose at that. If I had the opportunity to take the Johnson & Johnson, I would take it myself. It's a good efficacy rate when you think about, flu shots, your tetanus shots, pertussis, all of chickenpox, all of these vaccines are usually around 40 to 50% efficacy. So 60% is really good, and that's what we know now. As we get more people vaccinated, we'll be able to really test people who've gotten the vaccine, look at their antibodies, see how well they were done. That's one thing about vaccines overall. You think, okay, well, here's a vaccine. We're not going to think about it anymore, and you start giving shots. Manufacturers, pharmaceutical companies, even the CDC are continually studying how vaccines work and how well they work, if there's any issues and any problems. That's an ongoing effort. So, we've learned about the Pfizer study, the Pfizer vaccine through Israel has done a lot of studies because they vaccinated their population with Pfizer. We're going to learn a lot more about the Johnson & Johnson vaccine. I would not snub my nose at it as 60%. I would jump at any opportunity to get the vaccine.
Well, you brought up an interesting statement that makes me think back many, many years, for that matter, when you're talking about worldwide. First of all, this is a pandemic worldwide. This is not just the United States. So you just mentioned the Pfizer and the other countries that are dealing with getting these same vaccines, and they have some of their own, maybe their whatever, but we're talking about basically billions of people, which you put all the total in there. A lot of people struggling and wanting to get the vaccine. And then I liken it back to what you talked about, smallpox and some of the other things that I know I grew up with, getting vaccinated. And today we don't even think anything about it. But, I didn't know about the efficacy part of it, how well percentage-wise on those older vaccines that as kids, or when we give our kids those kinds of vaccines, how efficient they are.
And think about, I think it's really important. We've forgotten what life was like when these diseases that we don't think about anymore would run havoc in our communities. Let's think about polio and how the polio vaccine changed people's lives. It changed the world. What makes this pandemic interesting and what makes the COVID vaccine so important is not that it happened so fast, but as pharmaceutical companies, governments, communities, individual people willing to go through the test process came together for one single goal: get a vaccine, protect people from the pandemic. That's what makes this so exciting. That's why this happened so quickly. It was a worldwide effort to stop the COVID vaccine. Think about polio. The reason polio is no longer around is because it took a worldwide effort led by the United States to stop polio. This is the same thing. And
it has been basically eradicated. I know I'm a member of the Waco Rotary Club, and that's Rotary International. And thousands of clubs across the world have all focused on polio eradication years ago, and it is now getting where I think there's maybe one or two countries that only have 100 or 50. Just a grain of sand in the whole ocean type of thing, and that shows it can be done, and that type of thing. Well, let's go back a little bit and talk about the communication, because that's one of the things you're involved with, not only providing updated information, and you helped along with a big team of people back at the health district.
There's a huge team. I want to say, Larry, you're part of that team. Everyone that's part of this municipal information, it's an amazing effort. Again, you and I may be the face on camera, but there are 10 people behind us making sure that everything is correct and doing a wonderful job. So we want to thank that group too. I think
absolutely
they prefer not to be in front of the camera. That is okay. They keep us on the straight and narrow. I really appreciate the work that your team has been doing to help us.
Well, thank you for that. But again, kind of what we're talking about is the fact that every day the health district provides an update to the media primarily that gets out, and we post it on our Facebook and some of the other things, the numbers of the cases that are here, and that's a lot of tragedy involved with those. And I know your staff who creates those, it puts a mental stress on you when you look at the numbers and you're talking about the number of people who have died in our community, our family members, our community partners, our neighbors, and it's tragic to see that happening. And then when we put that information out, I know it stresses me as well. I know it does you. But that's something we have to do. But the communication is a huge part of this, and we encourage people to continue to do the things that we've talked about so often, the old wear the mask routine. Kelly and I are sitting about 9-10 feet away. She's got her mask. Mine's right here. And the minute we get up, we put them on, and we do that. We have the weekly press conferences that you participate in and help provide that information to the mayor and work on that. This is just the way we try to communicate what's going on with this and how to get over this. And it's a proven fact that the masks work, washing our hands, and all that stuff we've been talking about since March of last year. Is all about that.
You know, and the CDC put out a report 2 weeks ago that is really going further and in depth in studying on the successful use of masks and what a difference it can make. And once again, masks work. You know, it was not a cultural norm here in the United States. I think it is now when you realize, oh, wait, I'm protecting someone else. I'm protecting my parents or my friends, but oh wait, it's protecting me too. Yep. These masks really do make a difference. It's not something that we're used to, but it is life-changing. It can save your life and the life of the person next to you.
Absolutely. If you've just joined us, we're visiting with Kelly Crane, who's the communications lead for the Waco-McLennan County Public Health District, and always has the information, and it's so easy to provide it and kind of break it down into a simple manner that we can all understand. And that's so critical for people to be able to know the details on that. You know, we talked a little bit about the second dose coming up. Okay, so with the Moderna and the Pfizer both, there is a second dose that normally comes, what, about 23, 24 days, something like that?
Correct. For Moderna, it's 28 days, and that's really the one that I focus on because that's what we're offering. So 28 days. Now, that doesn't mean that on day 28 you better get that vaccine or it's not going to work. That is giving your body time enough to respond to the first dose so you can get it at the 28th day or after. And CDC is saying anywhere from 3 weeks to 6 weeks. You don't have to have it right at that 28-day mark. You just don't want to get it too early. You want to give the whole purpose is to give your body time to respond to the vaccine and to create those antibodies. And you think of the second dose as your booster dose. Remember, as a child, you always got to have a booster dose of something. This is your booster dose. So you'll get that 28 days after your first dose.
Now, let's go back a little bit. Maybe I jumped ahead on that question, but first of all, in order to get on the list for the 1A, 1B, to get a vaccine, you have to get on the wait list for the county, for the McLennan County Public Health District.
Absolutely. And we
talk about that process, and then I want to follow up and make sure people who have gotten the first one know how they will be contacted regarding the second dose.
Absolutely. So we do have a wait list, and you can get on that wait list one of two ways. Of course, you can get on covidwaco.com, and we have a nice big red button on the front page, and that will register you for the wait list. Or you can call into our call center, which is 254-750-1890, and you can register yourself by phone. And we encourage anyone, if you have a family member, a Sunday school, church friend, anyone like that who's maybe not as technical savvy or as comfortable registering themselves, help them, offer to register them, work with them to make sure that they get registered. This is a community effort, and we need our vaccine ambassadors, our people out there making sure that their friends, neighbors, and relatives are registered. So that's how you register. Now, what we do is, one of the things, we get our vaccine weekly. So you may not be able to schedule your appointment that far in advance. You may be able to schedule it. We're really working on a weekly system, week-by-week basis. So for our clinics on Thursday, Friday, and Saturday, we'll start scheduling on Monday, and we will schedule all through the week, making sure every vaccine appointment is taken care of. So don't expect a confirmation or call until the week of the clinic, and that's really important. People say, I'm on the list. When can I expect a notification? The week of the clinic. That is the concern, the week of the clinic. Another thing people ask is, well, where am I on the list? That is a fluctuating number because we, of course, are giving out vaccine every week, so that changes the number of where you're on the list. And we also have people calling, and they'll cancel because they've able to get the vaccine elsewhere. And so it's a constantly changing number. So it's really difficult to say, well, you're number, 37 on the list, when that's going to change constantly. We just ask, for patience and persistence to get yourself on the waiting list, and then expect you can expect a call the week of to get your appointment, so check your email regularly. Not everyone checks their home email regularly, and I understand that. I'm the same way. I look at email all day long. I don't necessarily look at my email when I get home. But check your email daily to look for those notifications. Also, answer a phone call from a 750 number, because that's our call center wanting to make that appointment. So we're going to do both ways, because we know not everyone has email. So please be ready for that call for your first dose, and expect it the week of.
Yeah. And just to give people the reality of, we've got literally thousands. I don't know how many are still on the wait list, but it's maybe 15, 20, 25,000 or more.
Yeah, it's at least 30. And I hate to say that because the people will just be intimidated about that number and say, well, I'll never get on. I'll never get one. Please do not be intimidated. Please be persistent. It will take 5 minutes of your time to get on the wait list, and then you can get on any other wait list you want. Take every opportunity you can. Don't be intimidated by that. We're not knocking anybody off the list. So we're committed to working through the list. Yeah. And the more vaccine we get, the quicker we'll be able to go through it. So please don't be intimidated by it. It'll take 5 minutes of your time to register. Just go ahead and do it.
Yeah. But if you're on the list and you are able to get one someplace else, like Kelly said earlier, please be sure to call back. Let us know so we can take your name off the list. Don't occupy a spot that somebody else is desperately wanting.
And it will not hurt our feelings. And actually, we are thrilled when people say, oh, I got my vaccine somewhere else. And I know it. If you happen to reach me, I'm going to ask, oh, that's wonderful. Where did you get it? Well, tell me the process. I want to know those things, because I want to understand how it's working for everyday people and how they were able to get on the list. So, again, it won't hurt our feelings if you get on another list or you get shot somewhere else. We just want you to get vaccinated.
Okay, let's go back to the second dose now. How do people, let's say I've gotten my first vaccine and it's getting close to that 2-3 week time where I said, hey, I should be getting a call pretty soon.
Exactly.
What is the process? Do I have to re-register? Do I have to do anything, or am I just waiting for it to be contacted?
Well, the first thing you need to know is that you do not have to be on another wait list. If you receive your shot through the health district, we already have your name ready to go for the second dose, and understanding when you need to get it. The second thing is, last week was our first opportunity to give the second dose rounds through our hub situation. Just like with the first dose, we get the vaccine on a weekly basis. And so if you are due this week, do not expect a call until this week. You will receive a phone call and an email. And when you do that, you can go ahead and contact the call center, and they will schedule you for your appointment. And that's all you have to do. We would love to schedule out 2 to 3 or 4 weeks in advance, but just based on certain criteria, what's going on with the weather, on whether we're going to have an indoor clinic or a drive-through clinic, based on whether the vaccine is available, we're still, we still don't want to overextend ourselves. The state is living up to what they say and sending us weekly, but we really hesitate to schedule until we get the vaccine in hand. So be patient with us. We haven't forgotten you. If you've gotten your first dose, just know that you're not going to get a call until the week of your shot is due. So, and that could be Monday, Tuesday, Wednesday, even up to Thursday and Friday. So just be ready. I mean, we have to contact 1,500 people for a week for that second dose. So it's going to take a little bit of time.
It's a lot of extra effort going on. We always deal with rumors from time to time on different things, and there's some rumors floating around, not very many, but there are some, but let's answer all the questions we can on this program about the second dose being really hitting you hard type of thing. Kind of walk people through how they can expect to maybe react to it.
And that's a really important question. And remember, anytime you get a shot, you can expect a certain amount of side effects. It may be, for some people, as simple as a sore arm. For others, it could be more extensive into body aches, even a fever overnight, depending on when you get it. That is actually, it doesn't seem like it's normal, but that's a normal reaction to any vaccine. That happens because your body is responding in the appropriate manner. It is recognizing that you have something in your body that you're not supposed to have. You have that little COVID marker, and it's saying, oh no, this is the bad guy. Vaccine tells your body this is the bad guy, and the body creates antibodies to get rid of the bad guy. So that's what it's doing. And you will see that in the first dose, and you will see that on the second dose. For some people, it can be a little more than expected. For other people, it's just a sore arm. Those are the lucky people. But first, expect a side effect. That is okay. It seems to go against common sense, but that is normal. Another thing we talked about earlier, was that people are saying, well, I don't want to go through that. I don't want those side effects. That's awful. Remember, think about, overnight not feeling well as opposed to 2-3 weeks of being sick with COVID, isolation, hospitalization, potentially, not even going to the greater issues, and then just being isolated from your family for at least 10 to 14 days because you're sick, and potentially spreading it to someone else. Not feeling well overnight or even 24 hours after, as opposed to hospitalization and 14 days of isolation. The choice is simple. Get the vaccine. It may or may not cause a side effect. That's okay. That's normal. Go ahead and get the vaccine. It'll be worth it.
I got one more question about COVID. Then we're going to go into the flu real quickly before we wrap up. After you get the second dose, you're now immunized, and most you can get. What is the time frame before you feel like you are going to be really protected for it to be? And I'm not saying it's time to take your mask off, because you still need to wear your mask. That's what everybody's still saying till this whole pandemic is over, and it may be next year even. Who knows? But after you get your second dose, what is the time frame before you theoretically are protected?
As we understand now, at least 4 weeks. You want to give your body at least 4 weeks to
after the second dose.
After the second dose, to really respond and get your body to respond. That's what we know. Of course, that could change as, again, we are continually studying. CDC is continually studying. The manufacturers are studying what are the antibodies producing, how quickly do they produce. So, but expect 4 weeks as just kind of a marker, a standard amount of time.
Okay. Let's talk about the flu, because the flu is, we got a couple of minutes left. So bring us up to date kind of where we are and why the medical community is always saying, still, we got the flu out there. Let's deal with that and get a vaccine.
Well, let me tell you, I know somebody over the Thanksgiving holidays that had flu and COVID at the same time. It was not fun. Flu is still there. I wish flu got more respect than it does. It can also make you very seriously sick. It may not hospitalize you, but it can knock you out for a week or so. Take flu seriously. It's still around. We're not seeing the high numbers that we have in the past. That could be for many reasons. One is that we're actually social distancing and wearing our mask, and that's making a difference for flu. I wish people would do that more often.
We tried to say that, but nobody wants to wear a mask during the flu season without COVID. So.
Exactly. So those measures are making a difference across the board, not only on COVID, but they're making a difference for flu. So don't forget about flu. Get your flu shot. It's not too late. Flu season can extend into March and April. It can ruin your spring break. You don't want that to happen. Remember, if you're getting your flu vaccine, or any vaccine for that matter, you need to wait 14 days between your flu shot and your COVID shot. Please wait 14 days, because we want to give your body time to appropriately respond to one vaccine before we give it another.
Yeah. Those are challenging things, and we need to think about that, because you don't necessarily know when you're going to get your COVID vaccine, and you don't want to say, well, I'm sorry I can't because of 2 weeks. So it's kind of a hard decision. But, I think the mask and all those kind of things. Real quick, you've had some great partnerships. You mentioned Baylor University. Talk real quickly about those.
Our community partnerships are essential. We couldn't do this without the entire community. So we have Baylor University, which is allowing us to use McLean Stadium for our drive-through. That is amazing. We have so much output through that. They're not only providing the space, but they're helping with logistics and technical support. We also have the Louise Harrington School of Nursing from Baylor University. They provide nursing students on Thursdays, on Fridays. MCC School of Nursing provides Baylor students. And then Tarleton University is also providing nursing students. So all three of our major universities are providing nursing students, and that makes such a 20 15, a large number of nursing students. We couldn't do it without them. I also want to thank Baylor Scott and White Hospital System. They're providing nursing and logistical support on Saturdays. So we couldn't do this without support of our community.
Amazing team effort, community-wide on that. And we encourage everybody, if you've not registered for the vaccine, you do that. She told you how to do that. COVIDwaco.com is always the place to go. We also have a public information hotline. If you do not have communication by way of internet or email, go to 750-5606. English or Spanish, either one, kind of gives you the latest update of what's happening that week. That hotline is there. Wear your masks and get your flu shot. and all that kind of stuff. And those are just things that Kelly Crane, our guest, who is the communication lead for the Public Health District, been our guest today on City Talk. Kelly, you sit in this chair more often
I know, it's different to me.
You really didn't feel very comfortable but fantastic job, you and the whole people, your backup staff that provides the information, provides on this whole pandemic, and we're so thankful for that. And we're all going to get through this, and someday we'll look back and say the year of 2020, 2021 even, for that matter now. But we just need to take care of that. Thanks for what you do. Thanks for being with us this morning.
Thank you, Larry.
And I want to thank all of y'all for watching and listening, and hope you'll join us again next week for more information about the City of Waco here on City Talk. This program is produced by the Municipal Information Department of the City of Waco and is provided as a public service by this station.